Alright guys, so we continue talking about the triangles of the neck. So in this video we're going to primarily focus on the posterior aspect, where we'll be talking about the posterior triangle of the neck. We have already talked about the anterior triangle of the neck. So if you haven't watched the first video, I advise you watch the first video so that it makes sense. Okay, so the posterior triangle of the neck is basically divided into two subdivisions. Okay, so now before we go to each subdivision, let's remind ourselves or the borders bordering this triangle. Okay, so on its medial aspect, this triangle is bordered by sternocleidomastoid muscle. Okay, sternocleidomastoid muscle. On its inferior aspect, it is bordered by clavicle. On its lateral aspect, it is bordered by trapezius muscle. Okay, so now let's come over here. We talk about the subdivision of this triangle. So this triangle is basically subdivided by inferior belly of omohyoid into two. Okay, so we have this triangle here, we also have this triangle here. Okay, so the muscle which is dividing this triangle into two, it is called inferior belly of omohyoid muscle. So the superior belly is here. Okay, so this in dark red here is one muscle which continues from all the way from the hyoid bone to the shoulder here. So omo means shoulder, so the muscle itself is called omohyoid, so meaning it is originating from the shoulder and it is attaching to hyoid bone here. So that's the name, hence the name omohyoid muscle. Okay, so now what is important when talking about the posterior triangle, it is basically the inferior belly of omohyoid muscle. Okay, so let's start with this triangle here. So the first triangle here, which I have labeled number 1, it is called subclavian triangle. Okay, so the subclavian triangle, let's talk about the borders. So on its anterior aspect, it is bordered by sternocleidomastoid muscle. On its inferior aspect, it is bordered by clavicle 2/3. Okay. On its posterior aspect, it is bordered by inferior belly of omohyoid muscle. Alright, so we are done with the borders. So let's talk about its content. Okay, so the main content of this triangle is obviously subclavian vessels, because we can trace it from the name itself. The triangle is called subclavian triangle, so obviously we'll find subclavian vessel in here. So it should be noted to say any region to this triangle, it can affect subclavian vessels, and once the subclavian vessels they are affected, we know to say the subclavian vessels, they are the one responsible for supplying the upper extremity with the blood. Okay, so obviously we have someone we have lesion to. Obviously, once someone has a lesion to this triangle, there will be paralysis of upper extremities because there will be no blood supply to the upper limbs. Okay, so we are done. We have already added clinical correlation on this triangle. Let's go to the next triangle, which is just adjacent. So this triangle is called occipital triangle. So the occipital triangle borders, we start with the borders as usual, then we go to its content. On its anterior aspect, it is bordered by sternocleidomastoid muscle. On its posterior aspect, it is bordered by trapezius muscle. On its inferior aspect, it is bordered by inferior belly of omohyoid muscle. Okay, we are good to go. Let's go to the content. So the main content of this triangle, it is basically accessory nerve. Okay, cranial nerve number 11. Its spinal roots, because the cranial nerve number 11 is subdivided into two roots. So we have cranial roots as well as the spinal root. So the spinal root is the one which comes and pierces this muscle, which is the sternocleidomastoid muscle, and then crosses this triangle to innervate a trapezius muscle. So it should also noted that any lesion to this triangle, it can lead to damage to these muscles. Okay, so these two muscles, they won't perform their main function, because we know to say the accessory nerve is the one which is innervating the trapezius muscle as well as sternocleidomastoid muscle. So in the case whereby the accessory nerve has been damaged, meaning this muscle won't be able to perform its function. The trapezius muscle is the muscle which is responsible for elevation the upper limb, so it elevates the upper limb. So it's the one which we use normally when we shrug our shoulder when diffusing. So this is the muscle which is involved. So if there is lesion to the accessory nerve, obviously we won't be able to shrug our shoulder. Okay, so now we are done with the posterior triangle. We have already added the clinical correlation of it. Alright, so guys, this is all what we need to take notes about the triangles of the neck. Until next time.